today is I'm going to quickly go over a little bit of a refresher of what we did yesterday on the call, on the training, which is go over the note and go over the iPad and the different features. So right now what you're looking at is you're looking at my iPad screen, and as you see at the bottom there's several icons. The one that we're going to use the most is the Dr. EHR icon. That is the iPad version of the Dr. Chrono app, and that's the easiest one and the best one to use when you're out in the field. But there's also a version that is online. You could use on a desktop PC, and that you could get from either the Safari button, which is on the very left. So if you click on the Safari button and you go to app.drchrono.com, that will bring up the online version, the cloud-based version, and then you just put in your username and password. And that will get you on the online version, okay? We also have provided a link to Centricity Practice Solutions that in the event you have to get some information on the patient that maybe didn't come over yet, you could always do that, and that will help you set up. And that is the icon right next to that. And as you can see here, once it's set up, it'll take you directly to your desktop. And here in this case, my desktop is filled with lots of different icons, but nonetheless, this is the desktop that I have here. And you'll be able to access your CPS desktop from here as well.
My icons are completely different than yours.
All right, we'll be able to help you with that. They're there, it's just I just set them up a different way, okay? But the one today we're going to use is called Dr. EHR, Dr. Chrono. So the little green one at the bottom there, if you double click on that, it will open this up. You could then use your thumbprint or your password to
I can't hear anybody.
Yeah.
I'm here, but we lost him.
Yeah.
Aha.
Mhm.
I am back. Can you hear me?
Yes.
All right, sorry about that. It kicked me off. All right, it's not letting me show my screen, unfortunately.
Oh, you're back. We lost you there for a good minute.
Yeah, it's just not letting me show my screen, so let me try one more time. There we go. All right, let's get back to it. So you'll go to the Dr. Chrono, open up your app, and the first thing that you'll see when it opens up the app will be this screen here. The screen will have your visit schedule on the left side, and then it'll have information of any patient that you pick here. So let's say the first patient here, you'll have some basic information about the patient, scheduling, vital signs, things like that, but you don't have to worry about this stuff. There's not much here for that. What I'm going to do right now is show you how we schedule the appointments in-house so that you understand how this all works. Everything starts from a schedule. So for us to be able to have a visit start, our staff will have to put in a new appointment. And in this case, you could say new appointment, or if this is the staff that will do it. And actually, it's not going to start from there. Let me think where it starts from. It would start from actually finding a patient. So let me just put in a test patient, and we'll set up an appointment, and we'll go from there. Okay, so this is the screen that will come up. It'll ask us a bunch of questions here. It'll ask what kind of appointment it is. So let's say it's a follow-up assisted living. And it'll say which exam room it's at. And then it'll save. So now you'll see that there's an appointment here, Andy test. So when this appointment is on here and you're ready to see the patient, you will click on the patient. And there's several things that you could do here on this. So even if you don't want to start the visit, let's say you just want to learn about the patient. At the very top is the patient's name, Andy Test. If you click on Andy Test, it brings up the menu of all the different things that you could do for the patient or see. You could do everything from seeing the patient's information. You can see the patient's history, which is really the documents. So if you do the patient's information, it will show you all the patient's kind of information here, their telephone number, email address, and so forth. If you click on patient history, it will show you all of the patient history, and you have two ways to look at it, either in this type of view, or you could also look at it as a list. And it's in chronological order, as you can see now, so you can see how it is here. So everything from the prior visits or the current visit, let's say a prior visit, which was this one, so you could go through here and you could test that out. There's also problems here as well, so you can look at the problem list for the patient, and they're still working on this, so don't be concerned about this, that it doesn't look right. It should be fixed by next week. You can look at medications here as well, and you could refill medications here, and I'll show you how to do that. You could look at any patient flags that are in the patient's chart, which you don't really need to do. And you could also refill medications and so forth and so on. So I'll let you mess around with these in the future, but this is where you could find this. But when you want to see a patient and you're at the patient's location, you click Start Visit, which is on the right side. And this brings up the patient's document. And as you can see in the H&P, there's certain documents in here that we use. It starts at Chief Complaint, History of Present Illness, but there's one above it which is called Check-in Information. This is something we're not using right now, but in the future, it's going to allow patients or their family to add on additional information for us to look at, including maybe referrals or new medications or reason for the visit, questions and comments, things like that. But right now, we're starting a Chief Complaint. The Chief Complaint has different fields that are pre-populated and some that are not. The pre-populated fields are things that we either were able to move over from Centricity Practice Solutions or information that the staff was able to pull from medical records, hospital records, patient information, so forth and so on. So we're going to try to do everything possible to pre-populate the chart as much as possible for our providers so that you don't have to be glorified secretaries. But sometimes it's not possible, but sometimes it is. So the first thing you would do is, as you can see, this is a follow-up visit for assisted living. You could also add on here an additional information like for Chief Complaint, is this due to dementia or a fall or what the acute issue is if there's one or two or whatever it might be. That will help us look at the notes in the future. You then with your finger could click if this patient is in an assisted living or home, why the patient needs a visit at home. Maybe it's dementia, gait disturbance, and pain. Maybe now the patient has a weakness and requires assistance. And then the history of present illness is a very small field here, but if you click the pencil, it expands it as well. And this is the HPI, the history of present illness, that was from the last note. And you have several options here. You could come in here and you could edit. You could move this all down and you could type your own things here. Is seen due to headache. You could also, on the left bottom of the screen, use dictation. And as you can see, there's two things at the very bottom of the screen. There is a microphone and a little symbol with a curve looking up and a curve looking down. If you click that curve, it'll tell, and click what can I say, you could have voice controls on your dictation. So if you really wanted to get savvy, you could use all of these different voice controls to operate the dictation and almost never even have to touch the note with your hands. So as an example, The patient is seen for a fall period. The fall occurred after the patient tripped with their walker period. The patient fell onto their left side and injured their left hip period. The patient now has difficulty ambulating and weight bearing on the left side period. Next paragraph, next paragraph. The caregiver reports the patient also has some altered mental status and foul smelling urine, period. So as you can see here, you could dictate as much as you want here as well. And then you could go down and let's say you don't want to keep this field, you could select it and you could then delete this if you want. There's lots of different, very easy ways to do things. And when you're done with this, you just click save. The next place you go is family, medical, and social history. And as you can see here, this was pre-populated. If it's populated from CPS and the patient was never seen, in the area where it says uploaded past medical history is where we're going to populate that information. You have two options here. You could just look at it and do nothing with it, or you could erase it and then populate something in the past medical history any way you want. And you could have a drop-down screen. So let's say it's all these information here, plus the patient now has a TIA, or you could free type here as well, or one or both, or everything. Same thing with surgical history. You could either add things on the list, or you could free type as well. For immunizations, right now we're not really using this right now, but it's something that we'll use in the future, so don't worry about it. Family history, same thing. If we have information that's already populated from CPS, it will be right in the uploaded version. If you wanted to delete it and use the other information, you can. So for example, if we had information already in here and you wanted to go through this process of filling this out, you could then simply go into the uploaded version and select all and delete it, click save, and then just populate all the stuff here as well. Social history is the same way. If it's uploaded from a different system, it'll be on the right upper side there. But then if you want to use any sort of other information here, you could pre-populate it here as well. So forth and so on here, okay? When you go to medications and allergies, you may or may not see medications in here depending on if they fix this. Dr. Chrono is actively fixing the medications and allergies here. Anything that has an RX next to it is a live medication, which means you could actually go in there and you could prescribe it. Anything that does not have an RX next to it is a placeholder. It means that this was downloaded from a different system and is yet not active. So as an example, if you try to prescribe potassium, you can see here that there's nothing really here. It's not really prescribable. It's just a placeholder. So if you wanted to add on potassium for whatever reason, you would click the plus sign on the right side and you could put in, start typing potassium. You could pick which dosage it is. You could type what you need, how many you need, and then you just click save. And you'll see here at the very top, you'll have potassium chloride and it's active. If you want to increase it, and if you want to delete anything here, you click the pencil and then you could just delete the other one if you wanted to, okay? Same thing with allergies. Obviously there's interactions here, and if you wanted to look exactly what these interactions are, you just click on any interaction and it'll give you information about this if you're so curious. And then medication history, if it is a live patient and has real information, you'll be able to click review information from SureScripts and it'll download all the information from SureScripts that you could review and add on to the medications as well. Review of systems are the same way. If it's uploaded, it'll be in this box here and you could leave it as it is. But if you feel you want to delete that, you can, and then put in all the review of systems. Now it's very important on review of systems that you follow a certain protocol. If you click the button, it means that everything is normal. Everything is normal. And if you click the button here, you should not use negative and positive findings, because if you do that and you view the note, you'll see that for review of, let's just go here for review of systems, you'll see that general, I click that icon and it says no weakness, no fatigue, no fever, no significant weight change. But below that, I actually added on certain things, and it says patient denies decreased appetite, significant weight loss, trouble sleeping, and then I click some negatives, which says patient positives include increased appetite, weakness, weight loss, significant weight gain. So it doesn't make any sense here. So you shouldn't do that. What you need to do here is one or the other. So if you're using general negative and positive findings, you should turn this off. But if everything is normal, there should be nothing in the boxes below it. So that's a good example for head, ear, eyes, nose, and throat, where everything is normal. If now there's abnormalities, you would unclick that everything is normal. You could go to the negative findings and maybe put that the patient denies headaches or dizziness or hoarseness and nasal stuffiness as an example, but they're positive for vision changes, tinnitus as an example. And that's the way they'll pop up. And then you could also always add on something freehand. You could say positive for tongue pain, okay, whatever it might be. So these are all the review systems that you could go through here as well. Anytime when you're dealing with the note, you could go to View Complete Note at the very bottom there, View Complete Note. And if you click on that, you will now see the note up until the point that you've managed the patient, okay? So up until this point here, as you can see, we haven't done a physical exam yet, and it's empty here, right? When you go back to the note, you could click anywhere you want, physical exam, and once you continue on with the note, okay, then the note goes. So for example, this is the physical exam. The first thing you do is you go to the vitals, potentially. The vitals is on the right top corner, and you input the vitals. And if you click next, it's very, very quick and very easy to do. Now you don't have to put in height every time or weight, but the first time we're going to try to pre-populate that for us. And if you have that, it will calculate the BMI for you, body mass index. Okay, so that's today's. You can see that, and you can save that. Okay, if you wanted to see the trend, you could also on the right top there, you could see show vitals, and it'll just show you what you kind of put in here, or you could click here, and they'll show you the trend on top. So you go through, and you could go through the exam. So in this particular case, let's say I haven't done any of this other stuff here, so I could say neck is normal, the lungs, we have some abnormal sounds, we have audible wheezing, and maybe the audible wheezing is in the left lower zone. Cardiovascular exam may be normal, but here it says systolic for some reason, but I could delete that. Maybe on the abdominal exam, we have the abdomen is soft, non-tender, spleen is normal, but let's say the liver now is enlarged. And maybe you want to put, you know, liver 4 centimeters below costophrenic angle, let's say, hypothetically. And in skin exam, you might have, let's say, a rash, and then you could say positive under breasts. Okay, so forth and so on, okay? Again, anytime you click View Complete Note, and it'll show you what that note looks like so you understand what's going on here, okay? As you can see here, I finished the visit. Now we go to assessment. With assessment, it's all the way on the right side here, and this is where you're going to document everything, and it's going to show you who documented before. So if someone documented anemia and fall, as you can see here, it'll show up again, and maybe you want to document it again, or maybe not. You might want to put anemia, and you could say prior CBC stable, continue iron. With the fall, for example, maybe you don't want to deal with that now and you want to say headache. For the plan, you could type, or again, you could open up the pencil and you could say, the headache seems to be tension type, period. I will recommend Tylenol and heat over the shoulders, period. If the headache worsens, we may consider imaging, period. Now here you see, instead of headache, it said DD, so you could always go back and you could just type it in. And then you save. Then you go on to the next problem, maybe, hypertension. You could write maybe improved, whatever you want to do here. CHF, order echo and labs. So you could do whatever you want here. We have about 7 spaces, and if anyone feels that you need more, I'll be able to add those on. The last place is plan, and the plan is where we put in the orders. So as you can see here in the prior plan, we have orders that we put in, including labs and so forth. So if you're doing labs, let's say, you could do click yes or no, but let's say you wanted to do labs, and let me just erase this here. You click on the, and it doesn't matter if it's in-house or not. You could click on the labs and you could say, okay, I want to do a CBC and a comprehensive and a thyroid study and iron studies as an example. And if it's not on that list, you could just add on other ones. I want to do a BNP and whatever it might be. There's another list here of labs that we do outside, and you'll get the hang of it. Let's say you want to do hemoglobin A1C, testosterone, PT, PTT. You could add this on here. Maybe you're doing radiology, maybe you're not. But if you're doing radiology, we have a drop-down list, and you could click, let's say, ultrasound, and you could say you want to do a lower extremity venous duplex, and then you also wanted to do an echo. Maybe you wanted to do other things like CAT scans. We could also say, okay, and I also want to do a CAT scan or something like that. Point of care testing includes, and we're not doing this right now, things like rapid strep tests and things like that. That's there as well. Maybe you want to order you don't want to order physical therapy, but you want to order home health, and you could put in why you want to order home health, vitals, balance training as an example. And maybe you want to put in a referral, maybe not to podiatry, but you want to do a referral, let's say, to psych. Okay? We have some education here, and I'll clean this up, but you could write here, it'll be a lot easier here, where patient understands treatment, support systems, and that you spent 1 to 5 minutes with the patient, let's say. Okay, so you can fill this in. The reason why this is very, very important is the staff will now go into this when you have these orders here, and this is how they're going to implement your orders. Okay, so it's very important that everything that you want to do is documented here as well. And it's very important that everything that you do on assessment is here, because the billers will go in and they will add the problems to the problem list on your behalf and bill for the visit on your behalf as well. So it's important that all of this is in here. The last thing is called Meaningful Use Assistant. This will tell you if you're in compliance. As you can see here, the meaningful use criteria says that weight and height was not added. And it seems like you have to put it in every time, so no problem. You could just go back to here. And as you can see here, the patient's weight is 145, height is 65. And if you needed to, you could just go in here and just redo this again. But it's not necessary to do on everyone, as I understand it, but I'll confirm for that. Once you're done with the note and you're happy about the note, and again, if you go back to the meaningful use, it'll now be a check mark that you did everything. Once you're happy with the note, you could sign it. Now, let's say you wanted to prescribe a medication for this patient and you put in that potassium. You could then go to the Andy test and you could go to the medications here if you wanted to. You see the potassium here has an RX, the little pencil. You could click the pencil and then it lets you see what you want to prescribe. You could click on potassium chloride. You click send ERX. It brings everything up here. If you wanted to modify anything here, you can, okay, except for the medication here, but the SIG and everything else you can. The pharmacy is down here, as you can see. But if you wanted to add on a different pharmacy, you click on the, let's say it's after hours, you click on the magnifying glass, and based on where the patient's located, it'll bring up all the pharmacies around the patient. And you might ask the patient, or the family, where do you want it to go? And they might say, well, we want to use the CVS. So you could click on CVS, and it'll show you all the CVSs around the area. If it's still not clear, you could always put in a phone number. And the phone numbers that you could put in should not have spaces. So let's say it's 310-274, and let's see if anything pops up. Oh, okay, so it's Olympic Pharmacy. You could click on Olympic Pharmacy. You could add to favorite, set as patient default if that's the new pharmacy, and then that'll select the pharmacy. Once the pharmacy is selected, you click preview, the prescription comes up, and then you click send, and the prescription's on its way. I'm not going to do that because I don't want them to call us about a prescription for no reason. Once everything is done and you're satisfied, you then go to view complete note. At the very top, it says sign and lock. You click sign and lock, and you're done with the note, and you're done, okay? For the staff to know that there's any orders, it's very simple. You click the little plus sign. There's something called new task. You click on that, and there are some templates at the very top, and all you got to do is click patient visit orders, and it pre-populates everything, and it goes to the staff with all the information, including who the patient is. When you click on that, it goes to the staff, and you're all done. If for some reason you feel, oh my God, I did something wrong with the note, I want to add something on, all you have to do is unlock the note, and then you could go back and adjust anything you want, and at the end, when you're done, you click View Complete Note again, and then you sign and lock the note. So at this point, I want to pause. I know it's a lot of information, but I'll tell you that it's not that difficult to use. Today I saw 12 patients, about 13.5 equivalent patients, including annual wellness visits, and I did all my notes in real time. So every note I did before I got home. So it's definitely doable to do. Now, I'm not asking everyone to do the notes at the point of service. It would be fantastic if you did. But at minimum, you must, and this is mandatory, you must at minimum add the vital signs, add the assessment, if you can, and definitely add the plan of what's being done. And clicking on tasks and letting the staff know if there's additional information that needs to be sent or implemented, that you do this. In addition, if you need to do any sort of prescriptions, that must be done at the point of service. So I'm going to show you how to do the prescriptions again. You go to medications. If the medication is already here, you don't have to do anything here. All you have to do is go to Andy Test or the name of the patient. You go to medications on that screen, and then you click the pencil, and then you could prescribe medications here. If you wanted to prescribe a new medication, you could do it from the patient's chart, or you could click the plus sign from the Andy, medications, plus sign. You could then add on the medication here. So let's say the medication now is Tylenol, and you will have a quick list as well. So right now we don't. It brings up a lot of Tylenol, so you could say 325 milligrams, 1 tab, PO, Q 6 hours, PRN, pain. You want to give the patient 30. It's a PRN medication, so you just click the PRN. And let's say you only want to do this for a week. You could do a start date by clicking this. Today you click, and then an end date. Let's say it's only a week. And you click on that, and that's it. And then you could save that medication, and then you could click the pencil, click on that, send RX, make sure it's going to the right place, click preview, make sure there's no interactions here. You could click on interactions and see them, and they're all here. Click on all this good stuff, and if you're happy with it, you click send, and it's on its way. Okay? So I could assure you that after 3 patients, you're going to get the hang of it. It's going to be fine. So I'm going to open this up right now for any questions or comments. Anyone? Okay, great. Well, I've recorded this, and we will send it out as well for you to do. And someone's speakers are way too loud, and you're getting feedback. Next week, we will have a session like this every day, starting at 6:30 p.m. I will have an open GoToMeeting for any of our staff that want to ask questions for the day's visits. They could log on, and we could troubleshoot those questions. And we will all be available during the day to answer any questions during your day. Thank you for joining, and we're excited to move forward. Bye.